So let's talk a little bit more within orthopedics, which is the area that I work in most. So commonly within physiotherapy, in the outpatient field, we could have people who had post-op surgery like hip replacement, knee replacement, or other surgery that might affect you. And some people, maybe they had fracture in the arms or legs, so afterwards they might have some stiffness and some weakness and obviously some pain. So our goal is actually to help them to regain their mobility, regain their strength, and obviously in the process to decrease pain. So therefore we have the ability to rehabilitate them back to normal life. And within the community, apart from the post-op conditions, we also deal a lot with, I would say, our backs. You know, a lot of people have neck pain, back pain. It's pretty common, and they estimated a large percentage of the population would experience back pain at some point in their life. So one of our main areas is to help people in this particular population to basically, again, regain mobility, regain strength, and regain function. Another big area, I guess, with our aging society would be the osteoarthritis, which commonly known as arthritis. So due to the degenerative changes in our joints, with some wearing off of our cartilage, people might start to have pain, which actually then affect their function and affect their life. So part of our scope is to also to help people to regain good function through those. And they've done studies comparing in the early to mid stage of osteoarthritis, physiotherapy is actually more effective than surgery in this aspect. So that's a very good news. And then I guess lastly, in orthopedics, then we also deal with people who may unfortunately have accidents through either motor vehicle accidents or through workplace, unfortunately. So we would deal with injury to rehabilitate them back into health. And I would say that's our biggest area of orthopedics. Now, also in addition to that, I suppose, and there's also sports injury there, where a lot of athletes in a very competitive field, or even recreational field, if they have some injury, we commonly know as sprain, strain, and or maybe some wounds and some cuts, and then we will help them to rehabilitate back into those optimal position, optimal condition that they could return to their sports. So I would say that's kind of a big broad scope of physiotherapy.